Hello, welcome to animatedteeth.com and our discussion of post-extraction instructions that apply to the time period starting 24 hours after having your tooth pulled and then the days beyond. In this video, we'll highlight some of the more important issues covered on this page. At this point, now a full day following your procedure, you should find that the bleeding from your extraction site is well controlled. That doesn't absolutely mean that there won't be a slight amount of blood oozing seeping from the area. But what you notice should be drastically different from what took place on day 1. If instead you notice continued or renewed bright red flow, you should let your dentist know. In the meantime, using day 1's technique of applying pressure to the area of bleeding for an extended period of time via a wad of gauze or tea bags should be resumed. Pain may be an issue for some patients during the days following their extraction. However, not everyone will find this to be true. Your dentist will have an idea of the level of discomfort you're likely to experience. And at the end of your procedure will most likely discuss over-the-counter pain relievers with you. The use of ibuprofen, also called Motrin or Advil, is frequently recommended. They may also provide you with a prescription pain reliever if they feel that there may be a period when something of that caliber is needed. Keep in mind, all medicines come with directions and warnings, so you'll need to pay attention to them. Overall, the general course of events you should notice is one where with each passing day your level of discomfort is ever gradually diminishing. If you find differently, then you'll need to let your dentist know. Until your wound's healing process is well underway, you'll want to favor your extraction site so not to disrupt it. Of course, you'll need to resume eating and drinking so you can maintain proper nutrition and hydration. And maintaining adequate oral hygiene is important too. But as you start to bring these activities back up to speed, always keep in mind the goal of protecting your extraction site. So, do your eating on the other side of your mouth and choose comparatively softer foods, like having peas, mashed potatoes, and meatloaf as opposed to a meal that includes chips, hard raw vegetables, and meat you have to cut up with a knife. When cleaning your teeth, especially during the first few days, stop at those at either end of your extraction site. As for keeping your wound clean, your dentist may give you instructions about dislodging debris with gentle rinsing starting a day or two after your procedure. The new tissues that initially form are fragile and vascular. So, if they do get bumped or scraped, don't be overly alarmed that they bleed easily. Although, this should just be minor and transient, as well as a warning for you to not do what you just did anymore. During the first few days of this portion of your recovery period, you'll need to transition the way you handle swelling that's taking place. We discuss what you need to do in greatest detail on our separate page that explains the management of post-extraction edema, so look for that. Generally, you can expect the swelling that forms to peak somewhere between 48 and 72 hours following your procedure. Then, from that point on, it should slowly resolve. So, up until it reaches its maximum, cycles of cold application will help to stymie its formation. After that, cycles of moist heat application will help to bring your swelling down more quickly. If your pattern seems to vary from the norm, let your dentist know. If any stitches were placed in your wound, and they are a type that will not dissolve away on their own, your dentist will need to remove them. A common time interval to return to their office for this simple service is 7 to 10 days. Look for our additional pages that discuss issues associated with sutures for more details. Once again, as days pass, the general trend should be one where you notice gradual and continued improvement in your condition. Your pain should be ever diminishing. Your wound filling in and healing over. And after the first 2 or 3 days, any swelling starting to subside. Of course, there are additional things to know, both in terms of do's and don'ts and what to watch out for, so make sure to read through both this page and its linked information. If you notice anything that seems to vary from your slow march to full and uneventful healing, it could be that some type of complication is involved, a subject we also address on this page. If so, don't hesitate in contacting your dentist. They're the one in the best position to interpret your symptoms. We'll also point out that, as the provider of your extraction procedure, they have an obligation, and no doubt a strong willingness, in assisting your needs during your healing process that follows. So don't hesitate to contact them. They'd be disappointed if you didn't.